blood conditions. Here are explanations of some common blood-related terms along with examples. Anemia. Anemia is a condition characterized by a decrease in the number of red blood cells or a deficiency of hemoglobin in the blood. Example, she felt constantly fatigued and dizzy, and the doctor diagnosed her with anemia, attributing it to a deficiency in iron. Anemia means without blood in ancient Greek, and means without, haima means blood, reflecting a deficiency in red blood cells. Thalassemia. Thalassemia is a genetic blood disorder characterized by an abnormal production of hemoglobin, leading to anemia. Example, the child's chronic fatigue and pale complexion were signs of thalassemia, a genetic condition affecting hemoglobin production. Thalassemia is derived from Greek thalasso, sea, and emia, blood, describing the sea region where the disorder was first identified. Aplastic anemia. Aplastic anemia is a rare disorder where the bone marrow fails to produce enough blood cells, including red blood cells, white blood cells, and platelets. Example, the patient's frequent infections and unexplained bruising were linked to aplastic anemia, a condition characterized by a severely compromised production of blood cells. The term aplastic is derived from the Greek word aplasia, where means without, and places means formation. Iron deficiency anemia. Iron deficiency anemia is a common type of anemia caused by a lack of iron in the body, affecting the production of hemoglobin. Example, her vegetarian diet without sufficient iron supplementation led to iron deficiency anemia, resulting in weakness and fatigue. Iron's origin is ancient Proto-Indo-European, evolving into Old English Isern and Middle English Iron. Deficiency traces to Latin, de meaning down from and fissere meaning to make or to do. Hypotension. Hypotension refers to low blood pressure, which is a condition where the force of blood against the walls of the arteries is lower than normal. Example, I've been feeling lightheaded and dizzy lately, especially when I stand up quickly. Could it be related to hypotension? Hypotension is named for hypo meaning low or under and tension, referring to blood pressure, denoting low blood pressure. Thrombocytopenia. Thrombocytopenia is a condition characterized by a low platelet count in the blood, which can impair blood clotting and lead to increased bleeding. Example, after the accident, his blood tests showed thrombocytopenia, explaining the prolonged bleeding from minor cuts due to a low platelet count. Thrombocytes, platelets, penia, deficiency. Signifies a low platelet count, characterizing this blood disorder. Polycythemia. Polycythemia is a condition characterized by an increased number of red blood cells in the blood, which can lead to thicker blood and increased risk of clotting. Example, following a comprehensive blood analysis, the doctor diagnosed her with polycythemia, explaining her elevated red blood cell count and increased risk of blood clots. Many, cythemia, blood cells. Describes a condition marked by an excess of red blood cells. Polycythemia vera. Polycythemia vera is a rare blood cancer where the bone marrow produces too many red blood cells. Example, his elevated red blood cell count and enlarged spleen were indicative of polycythemia vera, requiring careful management to prevent complications. Many, cythemia, blood cells, and vera, true. Denotes a bone marrow disorder with excess red blood cell production. Sickle cell anemia. Sickle cell anemia is a genetic disorder causing red blood cells to become misshapen and fragile, leading to various complications and reduced oxygen delivery. Example, living with sickle cell anemia, she often faced episodes of intense pain and had to manage her lifestyle to cope with the challenges of the misshapen red blood cells. Sickle cell, named for the misshapen, sickle-like appearance of red blood cells in this genetic disorder affecting hemoglobin structure. Hemophilia. Hemophilia is a genetic disorder that impairs the blood's ability to clot, leading to prolonged bleeding and easy bruising. Example, the young boy was diagnosed with hemophilia, and his parents had to be vigilant about any injuries, as his blood lacked the necessary clotting factors. Hemo refers to blood, and philia means affinity or love, denoting a genetic disorder causing impaired blood clotting. Factor V Leiden. Factor V Leiden is a genetic mutation that increases the risk of abnormal blood clotting, potentially leading to deep vein thrombosis, DVT, or pulmonary embolism. Example: after a thorough examination, the doctor identified Factor V Leiden mutation as the reason for her recurrent blood clots and prescribed appropriate anticoagulant therapy. Named after a genetic mutation in clotting factor V, increasing the risk of abnormal blood clotting. Von Willebrand disease. Von Willebrand disease is a bleeding disorder caused by a deficiency or dysfunction of von Willebrand factor, a clotting protein in the blood. Example: the young girl's prolonged bleeding after a minor injury was attributed to von Willebrand disease, a condition affecting the normal blood clotting process. Named after Erich von Willebrand, who first described this inherited bleeding disorder involving von Willebrand factor deficiency. Deep vein thrombosis, DVT. Deep vein thrombosis is a condition where blood clots form in the deep veins, usually in the legs, leading to potential complications such as pulmonary embolism. Example: after a long-haul flight, he developed swelling and pain in his leg, and the doctor diagnosed him with deep vein thrombosis, emphasizing the importance of early intervention to prevent further complications. Deep denotes location, vein specifies the blood vessel, and thrombosis indicates blood clot formation. Essential thrombocythemia. Essential thrombocythemia is a disorder characterized by an overproduction of platelets in the bone marrow, potentially leading to blood clotting or bleeding issues. Example: the patient's recurrent headaches and blood clotting episodes led to the diagnosis of essential thrombocythemia, necessitating therapeutic interventions. Essential, fundamental or necessary. Thrombocytes refers to platelets, which are blood cell fragments involved in clotting. Emia, a suffix indicating a condition in the blood. Hemochromatosis. Hemochromatosis is a genetic disorder that causes excessive absorption of iron from the digestive tract, leading to iron overload in the body. Example: his persistent fatigue and joint pain were finally explained when he was diagnosed with hemochromatosis, a condition causing an accumulation of iron in his organs. Hemo, pertaining to blood. Chromatosis refers to a condition related to color. So, hemochromatosis denotes a disorder involving blood and color, specifically referring to iron overload in the body. Leukemia. Leukemia is a type of cancer that affects the blood-forming tissues in the bone marrow, leading to an overproduction of abnormal white blood cells. Example: my friend was experiencing unusual bruising and fatigue, and after several tests, the doctors confirmed he had leukemia, a type of blood cancer affecting white blood cells. Look, pertaining to white. Emia, a suffix indicating a condition in the blood. So, leukemia refers to a group of blood cancers characterized by the abnormal increase of white blood cells.